YouTube. It has been a very long time since I've put an update, but seeing Nanner's journey, I had to put an update. Um, I hit my year surgiversary on June the 9th, which is probably about a week or so ago. Actually, a week and like 4 days. Um, so let me explain what's going on. So last time I blogged, I was in the hospital and having bleeding and stuff like that. And I was pregnant. Yay! But yeah, it was crazy because I was only like 6 months out. Let me tell you what happened about that. Gastroenterologist came in and basically told me that because I was pregnant and because I became very anemic, that and I became dehydrated because we as Rick's and Y gastric bypass patients become dehydrated very easily. It doesn't take very much to get us there. And plus me being pregnant added on all that extra stress to my body that it kind of just threw it into shock. So I killed 2 layers of my colon, and that's what caused the bleeding. But after about 4 days, I was able to go home and proceed with my normal life and carry on and everything, and kind of just sit back and try to enjoy the pregnancy in itself. And we had some scares because I had to go to the OBGYN and do lots of follow-ups. Do lots of follow-ups, and because at first we couldn't see anything and they were afraid that I was having an ectopic pregnancy and or that the pregnancy was invalid. At 7 weeks pregnant, we actually got to see our Cheerio, that's what we call her, and we found out also here about a month or so ago we're having a little girl, so it's going to be our first baby. We've waited for her a very, very long time. Trying to think of what else. Other than that, my weight loss. Let me tell you what I'm at. I got down to 170, and I got pregnant, and so my weight loss kind of just stopped. I hit that standstill, but that's okay. I've only gained 6 pounds, actually 6.5 pounds. And I'm 6.5 months pregnant, so about a pound a month. And that's really good because basically that's just baby. It's not anything that I've done, and I probably have lost weight because lots of mommies get about 25 to 45 pounds weight gain through their whole pregnancy. So my dietitian, I also see a dietitian at the WIC office. She just kind of helps me, go along with what, I need to do. Let's see here. I have collarbones, if you can't tell. I would show you my stomach, but I have this baby bump, and so I don't really want to do that. But I mean, I guess it's okay. We just moved into an apartment, so I just kind of, I'll show you the next video. So I'm gonna keep, I'm gonna start posting again. I have gained a little bit of weight in my face. That's where the weight I feel is, but I couldn't deal with the long hair. It was irritating me, and Texas heat is not kind to gastric bypass patients or pregnant women. So top that, I cut it into a bob, and it's not even fixed right now, but I thought I would do a video because I've seen Nanner journey and she looks fantastic, skin and all. Girl, you are rocking it. Okay, you look so fabulous. I can't even begin to tell you how proud of you I am. I haven't been on here in a while because I haven't had good internet service and was not able to upload videos because since my gastric bypass, we've had a lot of hardship, but we've made it through. And I don't take to snacking whenever we hit hard spots. I cry instead, and it's okay. It's okay to cry, and I've always cried. It doesn't matter. So at least I'm crying and not stuffing my face. And My eating habits, I usually, I do snack. I do 6 small meals a day because I'm pregnant right now, and I do snack. So every couple of hours, I'm getting in a little something. Um, so usually my snacks are like peanut butter and crackers, or um, peanut butter and celery. I crave pickles and cheese and green olives, and I hate green olives, but I do love them right now. Um, Lemons. Oh my god, I love salted lemons. Uh, what else? Um, we do see a specialist. That's another thing. Just in case anybody's wondering about being pregnant and having a gastric Rix and Y. Uh, I see my OBG once a month, and I also, starting about 18 weeks, you'll have an anatomy scan done on your baby. Um, I don't know what it's like or what they do anywhere else, but here, I live in Abilene, Texas, and here we have a specialist. He's a high risk specialist, and he does all of our anatomy scans for the babies that are born at Hendrick Medical Center. His name is Mark Mayberry, and he's really good. My OBG, he's great too. His name is Dr. Kroger. But I see him uh, once a month as well after my 18 weeks because of my surgery. Not because I'm high risk, but because they want to make sure that the baby continues to grow. And that is a major concern for women who have had Rix and Y and afterwards getting pregnant. So they have concerns that the baby won't grow like they should, or they'll stop growing. They'll have a growth restriction, and in which case sometimes it's severe that they have to go ahead and deliver baby. But my little Cheerio, she's growing, and um, here 2 weeks ago we seen Dr. Mayberry, and today I'll be seeing Dr. Kroger. So every 2 weeks I'm seeing a physician basically, which is a lot. She's been on camera more than any poor little baby has and should ever have to. But uh, she's a ham already. But she weighed 2 weeks ago 1.9 pounds. So I'm sure she's pretty much up to like 2 pounds right now, if not more. Because they start doubling in size. So she's going to be a healthy little baby. I just have this feeling. I have had some contractions. I had some Saturday night, and I don't think I was having contractions last night. I just think I was in pain because my pelvic bone was shifting. But Saturday night I did have some contractions, and I was in pain, but drank some water, which is key. I mean, you have to drink lots and lots and lots of water. And took some Tylenol, and I went to bed, and it stopped it. It helped. So it did scare us though. But she's great. We're gonna name her Zoe Celeste, and we have her room started and getting ready. I'll do my blog in her room next time because it's just fabulous. She's gonna be so spoiled rotten. And she's gonna have a semi skinny mom. I mean, I've always said I didn't care how much I lost as long as I was healthy. And I do have a lot of skin, but we're going to do a belly casting kit uh, uh, for me being pregnant, because this is very special. We didn't think that we'd ever have a baby, and we are. So I don't care how ugly my stomach looks when I hit about 8.5 months. I'm going to do a belly casting, and I'm prepared for that. I'm okay with that. No matter what it turns out, it's me, and that's all that matters. I'm healthy, and I'm able to have a baby, and I'm able to produce a healthy baby, and that's what matters. It doesn't matter about the baggy, saggy skin, and I look like the baggy, saggy elephant from the Little Golden Books. I started to look that way my first year anniversary back in October, and it hurt my feelings to feel like, nothing looks right on you or nothing fits right. And I do a lot of compression. Whenever I'm not pregnant, I do a lot of compression. I have a body sleeve thing that I wear to compress the skin, but it's better than the fat. I'd rather have skin than I had fat. Skin is ugly, but my husband doesn't care. He loves me, and nobody else has to see it. So we're okay with that. I'm okay with that. But everything's going good. I'm still sticking to my diet. I have cravings, of course, like a normal pregnant woman would, for cookies and chocolate and stuff like that. But only indulge like once, you know, once every blue moon. I try not to go overdo it because I don't want to gain that weight, and I fear for that. But 6.5 pounds in 6.5 months, that's not bad. Um, and as a matter of fact, I didn't even gain anything the first 4.5 months of my pregnancy. So that's totally great. I mean, I'm right on target with my weight and where it should be. Even if I was to gain maybe 10 more pounds, that wouldn't be, it would be nothing. I would still be within, you know, great, I'd be in marking point. So, but hopefully it won't gain that much. I don't want to gain 10 more pounds. But it's okay. It'll be lost once I have the baby, and hopefully I'll be skinnier than what I was before. So, anyways, to Nana's journey, you look freaking amazing. I love it, girl. You are just, you're awesome. You're an inspiration to me, and I know I need to vlog more often, but I've just been stuck in a rock and a hard spot. So I'll do another vlog and keep you updated and let you know how we're doing. July 7th, we have a 4D sonogram of the baby so we get to see what she really looks like and who she really looks like. I'm excited. So see y'all then. Bye.